Hello, everyone. Welcome to the Chari Center Health Hour. It's a pleasure to have you here today. Today, we'll be talking about natural solutions for depression. My name is Deepak Chari of the Chari Center of Health, so stay tuned. Welcome, everyone, to the Chari Center Health Hour. I'm Deepak Chari. And today, we have a very important show for you today called Natural Solutions for Depression. Before we get into that, I'd like to first tell you about the Chari Center of Health. We formed the Chari Center of Health over 20 years ago. Can't believe it. It's formed of my sister, the medical director of the Chari Center of Health, Dr. Chari, myself, Deepak Chari, and our mother, Mama Chari. The main philosophy of our Chari Center of Health is to find natural alternative solutions for medical, emotional, physical issues. And that's what we've been doing since day one. And we've had amazing results since then for thousands of people all over the US and all over the world. So that's a little bit background about us. Also, I wanted to tell you a little bit about what I do. I'm an engineer and certified biofeedback specialist at the Chari Center of Health. And what I do is I use a process called advanced voice biofeedback, where I listen to the sound of your voice. And your voice is the most accurate reflection of your subconscious mind. And I can help clear anxiety, fears, phobias, emotional traumas, depression, quickly and easily using the sound of your voice and advanced voice biofeedback, as I've done for thousands of people all over the US and all over the world, both in person and virtually over the past 20 years. And I can do the same for you too. So I just wanted to introduce you to that. I also wanted to tell you that every Saturday at 10 a.m. Pacific time, we have the Chari Center Community Clinic with live Q&A, and that's every Saturday at 10 a.m. So to sign up and register for that, and we have an incredible show tomorrow, all you have to do is text VClinic to the number 888-111. So remember to text VCLINIC, VClinic, to the phone number 888-111. And you'll see that information on the screen. So you can join us for that. You will get the registration link, and it's going to be an incredible seminar every Saturday. So please tune in for that, all right? So first, to begin with, I would like to start by introducing Mama Chari, who's a key pivotal person of our Chari Center of Health. So without further ado, I'd like to introduce Mama Chari.
Namaste. Welcome to the Chari Center Health Hour. This is our third program. And today we are going to cover some heavy subject. But I know you'll all enjoy it. And Dr. Chari is going to talk about how to deal with it. You know, if people have families, at least they have each other. The ones are alone. It is very, very hard. Very hard. And also people have to cancel their weddings. These people, the young people are planning for many years their weddings and look forward to that. But then they had to cancel everything. So that's very big depression for them. Now we cannot have any birthday parties, no parties, and no enjoyment, no sharing things. So suddenly we all kind of put in jail. So we are in a shock. So we don't know how to handle this, how to deal this. And especially the people are alone. It's a very, very hard time for them. And we all sympathize with you. And also, it is kind of time that we all have to be together. Now we all become like a whole family. We are like a one family, not one each country at all. We are all one family. We all have common problem. We all have common things, very much in common. And so it is, in a way, we are all together in this venture. This invisible enemy will go away sometime. We don't know how long it will take, but hopefully it will be pretty soon. And so we all like to be for you, with you all, and we want to give our support, our love, and our whatever we can share with you all. We like to do that, and I know we will fight this through. Like I said, I always say that when there is a dark room, you bring a candle, and that kills the darkness. So, like that, the time will come. We just have to be little bit patient, and we have to get used to this jail life for some time. But everything will be cleared. God is there. God is looking after us, and we all share each other our loneliness and this jailed life, but we are all together in it. So, in a way, it is strengthening all of us because we know we are not alone. So, this is so wonderful, but at the same time, it's very sad, and we all have to go through. But we are here to tell you that we all share all the problems we are having, and also we like to give our support and our love and our energy, whatever will help you all. We like to do that. And remember, we love you all. And also, above all, God is there. God is looking after us. But be brave. Don't be disappointed and don't be discouraged. And don't think you are alone. You are not alone. We are all together in it. So, just want to let you know, just be brave and don't feel sad. Don't feel depressed. Try to be happy. Find something to make you happy and try to see some funny movies or whatever it makes you laugh, or talk to your friends on the phone, or if you can't see them personally, but try to take your mind away from all this. But I would like to emphasize again and tell you, we are all praying for you and we are all with you. And above all, God is with all of us, and we are will certainly come through this with much better, and we'll all have a good times, healthy life, and also happy times, and the days are coming. So, but we have a wonderful program. Dr. Chari is going to talk about depression and also a little bit heavy subject today about suicides and all that, but that is happening. So we have to deal with it, and she's going to address that. She's going to give some nice advice how to handle it. But at the same time, we want to tell you we love you all and God bless you all. Thank you and take care.
Thank you, Mama Chari, for those wonderful words. We really appreciate it. I know you must have all appreciated as well. So, before we enter our presentation with Dr. Chari talking about natural solutions for depression, I wanted to give you some statistics that I just came across that will further add to the presentation. According to Vail Wright, who's Director of Clinical Research and Quality for the American Psychological Association, he said, compared with other traumatic events in the past, such as 9/11 or natural disasters, the coronavirus pandemic has a much broader impact across the country and has caused greater feelings of uncertainty, which increases a person's anxiety. Modeling from previous events of this magnitude suggests that the pandemic has exacerbated underlying mental health disorders, including anxiety, stress, anger, and depression. Dr. Simon Rigo of Montefiore Health System in New York told CNBC. He said that these issues are amplified when there's additional economic or medical stress or increased social isolation. The COVID-19 outbreak has caused all three, just to let you know. Um, Economic, medical stress, and increased social isolation. And people become at a higher risk for things like greater depressive episodes or increases in problematic coping strategies like substance abuse, Rigo said. You see some correlation data that suggests people are at greater risk for increased feelings and thoughts of suicide. So, this is a perfect lead in for our presentation, Natural Solutions for Depression, by Dr. Chari. So I'd like to, without further ado, introduce Dr. Chari, the medical director for our Chari Center of Health. So here's Dr. Chari.
Thank you, Deepak, and thank you, Mom, and thank all of you for being here today on our television program, the Chari Health Hour. We're so glad that you're here, and if you're watching a replay, we want to thank you for watching our show as well. I know these are very challenging times at the moment. There is so much that is taking place in our country and in the world, and that has been taking place for many months. And I know that many of you, if not all of us, have been feeling the effects of it emotionally in terms of feeling depressed, feeling frustrated, hopeless, helpless at times, anxiety. You may be having trouble sleeping. You may be, binge eating, going to comfort foods. You may be feeling restless or bored. All of these factors play a role. Sometimes you may not be feeling like yourself and just wonder, where is this all going? I want you to know that it's very natural to feel what you've been feeling. And also, most importantly, for you to know you are not alone. You are not alone. And please know that. This is really, really important. And know that we as a family, with our mother, Mama Chari, with my brother Deepak Chari and myself, we want you to know that we're here for you. And we're so passionate about what we do because we want to be of service. And know that you are priceless. You are a gift on this planet. And to know how remarkable you are. And we will all come out of this together, out of this entire situation. The world is literally going through a rebirth and a global awakening, the likes that we've never seen. But know also at the same time that going through this, has not been easy. And I know for many of you who have businesses of your own, you may have been affected by that or probably were affected by that. And, it was a very stressful time and knowing how to pivot your business, especially as small business owners. But I want you all to know that all of your businesses are essential. Businesses provide services to others to help humanity. So every one of your businesses is essential. So as we coming back into our communities, we need to support each other's local businesses, support our communities, and be there for one another. So today, the topic, again, if you're just joining us, is natural solutions for depression. And at first, some of what I will be covering today may seem a little bit heavy, but then I'm going to move into a lighter aspect in terms of solutions and being proactive and what we can do. And this may be life changing or even life saving for some of you. And the reason we are so passionate about bringing this topic up right at this moment is because of the massive increase in depression and anxiety. I know, we have felt all of these emotions ourselves, but what was most alarming to us was a dramatic increase in the number of suicides. And this is in people of all ages. And particularly, we're finding that especially with even those who are age 30 and younger, including teenagers and even preteens. And this was so alarming to us. So we want to make sure you have resources and that you can take proactive steps right now, even within your own families or with loved ones or your friends and with the community, because we all need to be very vigilant and proactive with regards to our emotional health and well-being now more than ever. It is critical. So again, thank you so much for joining us here today. Please share our program right now with your friends and family so that they can tune in, because this is a very, very important show. So now I'm going to begin again my presentation with some slides. But again, I just want to emphasize, even though a little bit of what I speak about at the beginning may be a little bit on the heavier side, there is a light at the end of the tunnel, and we're going to come with some very practical solutions as well. All right, so to begin with, are you feeling depressed? And this is a question I want to ask all of you, whether you're feeling it right at the moment, or if you felt it some period of time, in these last couple of months. Just really tune in to how you're feeling at the moment. And I know some of you may be slowly getting back to work, which may be a relief for you, to get back to some more of your normal routine. But again, a lot of what I'm going to be speaking about is really tuning into how you're feeling. Now, this was alarming that psychiatrists wrote 86% more prescriptions for psychotropic drugs. And this is, drugs used to treat mental and emotional issues, including antidepressants, this year in both March and April 2020. And this is according to Ginger, which is an organization that provides mental health services to companies. Again, 86% more prescriptions for medications for treating things like anxiety and depression. So this was pretty alarming. And the reason we're seeing such an increase in depression and anxiety is due to social isolation, health concerns, and unemployment. And I'm going to touch base on each of these, because starting with social isolation, when we were, all forced into our lockdown or quarantine, being socially isolated, whether you're alone or even if you're with family members, this is very significant. And the reason this is significant is because when people are socially isolated, what happens is that can actually weaken the immune system. And when the immune system is weakened, it actually makes us a little more susceptible, makes us more easily prone to getting infections, whether it's viruses or bacteria or whatever it may be, because of that weakened immune system. This is why being with others is so important, and why social community is very important. And thankfully, we can do this. We can still connect in different ways. And again, as our society, at least in some states, is slowly, very slowly coming back, this is going to be really important to connect with people virtually and, in person. And the second thing is health concerns. And because with, the current issue with the virus in the past couple of months, everybody's been wondering, how am I going to get this? If I do, what would happen? How can I prevent myself from getting this? So all of that anxiety and stress also has led to depression and anxiety, which also further weakens the immune system. So that's another very important point. And then, of course, there's unemployment. And the incidence of suicide increases, they say, with every percentage point increase in unemployment. And now with, millions of people being employed, this is why we need to be more proactive than ever before, So these are some of the reasons why we're seeing the increase in depression and anxiety. And then what are the effects of this? There's several, of course. Drug abuse, including, and there's been a very high increase in the overdose of even pain medications. Drinking more alcohol, and alcoholism is on the rise. And when alcoholism increases, then that also leads to more physical and emotional abuse at home. So, and this is leading to more domestic violence, and people and doctors and nurses are seeing this in the emergency rooms. And then, of course, there's overeating and binge eating. And the reason we do this is to bring us comfort, or to, help soothe our anxiety or depression. But what may end up happening then is, leads to weight gain. And if we're eating too many sweets or sugar that can further weaken our immune system and then makes us more susceptible to infections. So you see how everything is interrelated. And this was also very alarming that doctors at John Muir Medical Center in Walnut Creek, California, have recorded more deaths from suicide than from the coronavirus. And with a year's worth of suicides and suicide attempts being recorded in a 4-week period. So again, they saw a year's worth of suicides and suicide attempts being recorded in a 4-week period. So that is a pretty dramatic increase in the amount and the number of people both attempting suicide and who actually committed suicide. That's why we wanted to get this information out as soon as possible. All right. This is literally a national emergency. And so it's something, again, where we need to be very proactive. So now I'm going into this more of the solutions here. But the first thing I would like each of you to do is, first and foremost, if you can grab a piece of paper and a pen or a pencil and just write down, or do it in your phone, write down the names of 1 to 3 people that you could call and turn to if you were feeling down, if you were feeling depressed, if you were feeling too overwhelmed. It could be anyone, it could be a family member, it could be a friend, it could be a teacher, whoever that significant person or persons is to you. If you could right now just write down the names and phone numbers of anywhere between 1 to 3 people of who you would call if you are feeling anxious or depressed or feeling overwhelmed, please do that right now. This is really, really important. And also tell your loved ones that and ask them to do exactly the same thing, to write down who they would call in times of an emergency. This is very, very important. The second thing is getting fresh air and sunshine. The reason being is that it's so important to be outdoors. When we're indoors all the time and not seeing the sun or not getting out because of that fear, that can deplete your immune system. And the sun is so important. It affects not only our immune system and can boost our immune system, but it also lifts up our mood, makes us feel happier. And just imagine when you're in the sun, beautiful sun, and seeing that warm sunshine and feeling that on your body, it feels uplifting. So make sure that you get outside. And for those of you who may be in California, now we can go to the beaches. At least you can go for walks and just see other people. And for wherever you may be in any part of the country, and for that matter, any part of the world, please, please get outdoors. Call your friends or your family and say, okay, let's just go for a walk. But reconnect with people and be out in nature. This is so important. So important. Or meet each other up at a restaurant, because now more and more are opening and we need to support our local businesses. We need to support our local businesses, our local restaurants. So meet your family and friends at the restaurant. Have, some tea or coffee or a meal together. It'll really make you feel like you're getting back to normalcy again, even though I know still we're in the different phases right now. But whatever you can do, please reconnect in person and get outside with people that you love. And exercise. Simple walks are fantastic. Make sure you breathe in that fresh air, but definitely be outside. And of course, now many practitioners are and have been offering Zoom clinics and Zoom, exercise classes. But there's nothing that can come close to getting outside and getting some fresh air. And when they open, please gently start back with your exercise routines and yoga. Continue doing it virtually, but reconnect with people because that will actually boost your immune system as well. And of course, do it safely, but with the appropriate steps, believe me, you're going to feel so much better. Now, a leading psychiatrist, Dr. Sue Varma, she said on a Med Circle interview a couple months ago, she really introduced some powerful questions to ask someone. And these, she said, literally can save someone's life. So please jot these questions down. The first one is, even though it may seem simple, believe me, it's very profound. The first question is, are you okay? Because a lot of people say, oh yeah, I'm fine, but actually they're not. We're so used and conditioned to saying we're feeling good when we're not feeling good. So really ask them, are you okay? Number 2, ask that person, is there someone I can help? Maybe they're feeling stressed out about somebody else. So just getting that information may relieve a burden off of them. And, there may be something they want to share with you about another loved one. Number 3, the third question is there someone I can call? Because maybe they don't feel up to calling either their family members or their friends or any of their loved ones. They're just feeling too down and out. They feel too helpless, too hopeless. So maybe if you ask them if there's someone I can call and they say, I want to speak to this person, but I just can't. Maybe if you then said, okay, let me call them for you. And then you can explain to that family member or friend what that person is going through. That can be a true godsend in their life. You can be a true godsend in their life. Number 4, ask them, is there somewhere you want to go? Oftentimes with depression, you can feel so down and out, so feeling such helplessness or hopelessness, you just don't feel like even going out, even though that's the very thing that you need to actually heal emotionally and physically. And if they say, list a place or go shopping or whatever it may be, then maybe you can offer to take them there. And just being with you and getting out may be just what they needed and may be the most life-saving gift that you could give. And number 5, is there something you need? That is another very powerful and important question. Because again, a lot of times when we're feeling so down and out, we may not even know what we need. But just asking that question and then them knowing that there's someone who could help them and get that for them, they could share that with you. And it may not be even anything physical, but just mean, I just need someone to talk to. So, and you can be that person. And trust me, this can be truly life-saving. And loneliness is a public health crisis, and it needs to be taken very seriously. And at least 50% of people are experiencing this currently. So that's why it's so important to connect with others, with our loved ones, and with us as a community as we start getting out again. So it's going to be really important to be aware of how you are feeling. Oftentimes, we're, again, so used to worrying about others, but it's really important to look in the mirror and ask yourself how you are feeling. Are you feeling great? Are you feeling helpless? Are you feeling hopeless? And also the intensity of the feeling. And this is what the psychiatrist was saying as well, is that if you take 10 is feeling great and 0 is feeling miserable, kind of gauge where you're feeling. And of course, you can ask these questions to others as well to gauge where they are. But even for yourself, and most importantly for yourself, don't wait for that number to get to a 1 or a 0. When you notice you're like at a 5 or a 6, really start being proactive. And even if it's higher than that, but just always be proactive and be sure to check in with yourself. We're so used to putting ourselves in the back, but make sure you're always, number 1, taking care of yourself and asking yourself how you are feeling. And then we'll I'll go into steps of what we need to do from there. But check in with you. And now I want to give you also, and be sure to jot these numbers down, and I'm going to say it out loud as well, that it'll be very important for everyone to know, because you may need to share this number with others, the National Suicide Prevention Lifeline, which is 1-800-273-8255. Again, the number for the National Suicide Prevention Lifeline is 1-800-273-8255. Or another option is you can text GO, G-O, to 741-741. Again, you can text GO, G-O, to 741-741. And with that, you'll reach a trained crisis counselor through a crisis text line. And this is a global not-for-profit organization that's free 24/7 and is confidential. This is very important to know, both the phone number as well as what you can text, and you can share this information with others who may need it. Again, we are at a very critical time in history, and this information is so important. All right. And on that note, now I'm going to share with you what you need to do to be proactive for yourself. And again, share this with loved ones as well. And please encourage and invite others to come onto our show at the moment, which again, if you're just tuning in, is Natural Solutions for Depression. And again, I shared with you the heavier side of what is going on in this country, but now I'm going to bring you now to practical solutions, because you can be that sunshine. Remember, when there's darkness, just as our mother was saying, when there's darkness, when you light a candle, the room can light up and you can be that light. So it's important, again, as always, as I was mentioning before, to tune into how you're feeling, is to enjoy your hobbies and interests and just do what brings you joy. Don't worry about being an expert in that particular interest or hobby. Just do it because you love doing it. And for each of us, it may be completely different, and probably is completely different. And that's terrific. So see and ask yourself, what is it that I love to do? And even just say you don't know what it is that you love to do, just try something new. And again, you can do online dance classes, and then hopefully soon, when studios get up and are running again, you can again interact with others and dance, maybe singing, it could be acting, could be painting, could be so many things. It may be hiking, but with doing it maybe with some other people as well who love to do that. So just know that, again, we're slowly coming out of the phase that we're in, but no matter what, start doing what you love to do, even if it's just in your home, and then when the time is right, do it in a social setting. So find out what that is. And connecting with others. Most importantly, people want to feel needed, and people want to feel valued and that they have worth. Isn't that what we all ultimately want? Each and every one of us, it doesn't matter who you are, we all want to feel needed. We all want to feel valued. We all want to feel that we have worth. So know that you are worthy and deserving because of who you are, not because of what you do, but just because of who you are. You are special, and you are a priceless gift on this planet, and a priceless gift to humanity. Know that and really embrace that. That is so important. And again, connect with others, with your friends, and with whomever brings you, and your family, whoever brings you happiness and joy. Be sure to reconnect. Again, it can be through a phone call, through FaceTime, could be through Zoom, but now hopefully more and more we'll be able to start meeting in person as well. And we can all help each other. One of the best ways to come out of feeling depressed or even anxious is by reaching out to others, helping others. That brightens up your mood. You can be of service to another person, and it's so uplifting to yourself, to them, to our community, and to humanity. And it gives you that feeling of self-worth as well. And remember, it doesn't have to be anything major. It could be something as simple, even as when you go for a walk and giving someone a smile. I can't tell you, people are really literally starving for connection again. So when we go for walks, we smile and say hi to people. They say, "Hi, how are you doing? Hope all is well." And, it's so beautiful to connect with others. Just know that even a simple, beautiful smile from you to another person can make all the difference in the world. Trust me, it can not only boost your immune system, it boosts their immune system as well. And that heart connection is so important. I'll never forget, I remember we were in North Carolina at the time, and we were, having to do our taxes, and we were, not in the best of moods. And as we were walking to the accountant's office, we were all kind of looking down, and this man came out of the office so bright and smiling and just over on top. I mean, he looked like he was just exuberant, so happy and overjoyed. And we were looking at him, and he looked at us, he looked at each one of us in the eyes, and he said, "You all three are so beautiful. May God bless you all and have a beautiful, blessed day." And after that, we all perked up. We were so happy, so overjoyed, and going to the accountant, believe it or not. And it just made our day, and it completely shifted our mood. So just know that just a simple smile, saying hi, saying God bless you, whatever comes from you, it doesn't matter what you say, but it's all the intention, it's the feeling, it's a heartfelt connection that makes all the difference in the world. And I'll tell you another story. This was back about 2005, 2006. And we had just bought some, furniture at that time. And the man who made the furniture, he delivered it to our home. And it was interesting. After he delivered it and he was about to leave, and at that time, I don't know if you remember the movie The Secret. It's a powerful movie. And when my mother said, suddenly stopped him before he left. And she had us get the video, because we had that copy. And she told him, she said, "I want you to watch this." My mother suddenly looked at him and looked right in his eyes, because our mother is very intuitive, and she looked right into his eyes. She said, "Please watch this movie, The Secret. Watch this movie, and I want you to call me tonight and tell me that you watched it." And first, my brother and I like, "Mom, why are you telling him and forcing him to watch this movie?" But then Mom noticed something. And so again, and she kept insisting, and she said, "Please promise me that you'll watch this movie tonight and you'll call me tonight itself." She goes, "It doesn't matter how late it is, and tell me that you watched it." And she repeated this several times. And then he just looked, and he was kind of silent. He said, "Yes, Mrs. Chari, I promise you I'll watch it." And she said, "You have to promise me." And he said, "I will, I promise." Then he left. Then we were asked our mother, "Why did you so insistent that he watch the movie?" She said, "No, I felt that I had to tell him this." And then we went about our business, and he called later that evening, and he said, "Mrs. Chari, I just wanted you to let you know I did see the movie tonight, and thank you so much." And my mother said, "Oh, thank you." And she said, "It's an honor for me." And she said, "And I want to let you know I'm blessing you. God bless you, and everything will be okay." And then he said, "Thank you so much." He said it very silently, and then hung up the phone. We didn't hear back from him until a year later. And he called, and he said, I picked up the phone. I'll never forget this. He said, "Hello, Dr. Chari." And he said, "Please, can I talk to your mother? And I want you and your brother to also be on the phone." And he started crying. And I said, "Oh my gosh, is everything okay?" He said, "Oh, it's okay. Please, please." And I said, "Okay, of course." So I called my mother and my brother, and he said, "Mom, I want to tell you thank you so much. A year ago, you told me to watch the movie. You looked into my eyes, you held me, and you told me that to watch the movie The Secret and to call you that night, and that no matter how late it was, that I had to watch it and had to tell you that I watched it. And Mom said, yes, I remember. And he said, I don't know if you realize this, but you saved my life. That night, I was planning on killing myself. And we were in a state of shock. He said, my business was going down. I actually got an insurance policy so that I figured I would be worth more dead than alive. And I bought a gun and I took care of everything. And that was my plan after I delivered. Couldn't believe this. Your furniture that night, I was just going to have dinner with my family and then kill myself. But because of you, Mom, and so he said, because of you, I completely changed my life. That night I saw the movie and I knew that you loved me and you blessed me. I didn't, and I decided not only am I not going to kill myself, I'm going to make a vow to help others who are suicidal. So he started a mission under the name of Mother Teresa, and he helped, I don't even know, I can't even tell you how many hundreds and hundreds and hundreds of people of all ages, all walks of life, all races, male, female, children through the elderly. He prevented them from committing suicide. But it was because of the gesture from my mother. And so he said, it's because of you I'm alive. And I've now been able to help hundreds and hundreds of people in saving their lives. So thank you and God bless you. We were crying and crying and crying every time I remember that even. It's like I get teary. So I want you to know that you do make a difference. You make a difference on this planet. You are priceless. You are the most priceless gift to humanity. Please know that. Please know that. And being compassionate, asking compassionate questions to yourself and others is the most important thing that you can do. Practice being compassionate with yourself first. That's number one. Love yourself and ask yourself, how am I doing today? How am I doing? Remember to always check in with yourself. And ask yourself, what is soothing and nurturing for you? That is the number one question. Make sure you bring it back to yourself. Thank you so much. So,
Wow, what an incredible presentation, Dr. Chari. That was extremely inspirational. That was extremely inspirational and touching and moving. I know you must have all felt that. Please share your likes and loves in Facebook and for how much you appreciated Dr. Chari's presentation today. We would really appreciate to hear from all of you and your wonderful comments about her presentation today, because I know it was very inspiring and very heartfelt. So thank you so much, Dr. Chari, for that incredible presentation. Thank you.
thank you.
So now we're going to do the live Q&A for any questions that you may have had during the presentations. So let me go ahead and take a look at the board here. All right. So I don't see any questions just yet so far. Is there any other comments you'd like to add, Dr. Chari, for your presentation today on natural solutions for depression?
Absolutely. Absolutely. I again want to emphasize how precious you are. Know that you are a treasure on this planet and for humanity. The world needs you. The world needs you now. And know that you need to truly, we all need to do this on a daily basis, is really love ourselves, cherish ourselves, really find what brings you joy, what makes you happy, whatever it may be for you. Be sure to do that for yourself, and then connect with others. I can't emphasize that enough. Connecting with others is the most important thing one can do as of service. Believe me, it's a service to yourself as well, because it uplifts your soul, and of course to others as well, because we are all interdependent. No man is an island. We are all interdependent. We all need each other. We all want to be with each other. And luckily, as all of this quarantine is coming, the different phases are being rolled out, we can all, again, come together, be together, eat together, but we can still connect even virtually by phone or FaceTime, but just be sure to connect with others. And again, find out who are those special people in your life you want to connect with and be sure to connect with them.
Wonderful. That is so beautiful. And I just thought I'd share a comment in the chat room by Tracy, which are just wonderful comments. She wrote, "These are great, simple actions to take. Thank you, Dr. Chari." And she says, "Thank you, Dr. Chari, for addressing such an intense subject and providing such loving, doable solutions."
Oh,
And
thank you, Tracy. Thank you so much.
yes,
We really appreciate it.
thank you so much, Tracy. And she also thanked me for being a wonderful host. So thank you very much,
Oh,
Tracy. I so appreciate that. It's such a pleasure. So wonderful. So that being said, Mama Chari has a few comments to make, and then I'll say a few closing words before we close our show. So we'll go ahead and add Mama Chari. There she is.
Thank you, Tracy, for your kind compliments. Thank you. We love you. I just wanted to say we are all God's children. God is created each of us very special. Each and every one of us are very, very special. We are very unique. And God created us. And God put us on the earth to do our duty. Because we all come here for a purpose. And each and every one of us, we have purpose. It is small or big or whatever it is. The purpose is very, very important, very crucial, and very, very important to the society. So, and all of each and every one of you, you are very, very special and you are very unique, and God created you on a purpose. So, please remember, you all have a purpose and you all have a duty and you all have to live and finish your duty. And I just very, very much wanted to tell you that each and every one of you are very unique, very, very special. And you all have a duty and we all have to contribute. That's why God put us on the earth. So don't think you are no use or anything. No, never. Each and every one of us, whatever it is, we have a purpose. So remember that. That is our goal, our purpose. And do that and be happy. And all these depression and bad times will go away. We all have to go through in life sometimes or other. And right now, the whole world, we are family, world family. So we are all facing together. You are not alone, believe me. All over the world, we are all feeling the same thing, facing the same thing, and we'll come through. God will give us energy, strength, and courage, and we'll all come out of this. And but be remember, you are very unique, and God put you on the earth for some purpose. And remember that you have a purpose, and so you are very, very valuable. So always remember that, and we love you all very, very much, and we always pray for you all, and we are all with you for us here for all of you. Please remember that. And we love you all, and God bless you all. And be brave and be strong and try to be happy. Find something to be happy. I'm sure there is always something. And try not to be depressed, not to be unhappy. We'll come out of this. Right now, I think we are a kind of gotten used to this, but now everything will become normal and regular. So we all have a wonderful times ahead. And but like I said, be brave and be courage. And we are here for you. And all of us are loving each other. Right now, we are all sharing the love among each and around the world. We are the world family now, not anymore one country. We are the world family. So we are all sharing that. And we are all sharing the love and of course the pain, everything we are all sharing together. And so we are not alone. So remember that. And above all, God is there. God is looking after us. Please remember that. And so I just wanted to let you know we are all here for all of you. And of course, you are all here for us as well. So we want to share our love to all of you. Bless you all. And remember, we are all for each other. And I just wanted to thank you and God bless you all. Namaste.
Thank you so much, Mama Chari, for those beautiful, beautiful words. We want to all thank you for coming here for this incredible presentation, Natural Solutions for Depression. And please definitely sign up for our presentation tomorrow at 10 a.m., the Chari Center Community Clinic, 10 a.m. Pacific Time, by texting VClinic to 888-111. That's text VClinic to 888-111, and you'll get the registration link. Make sure you attend that. It's going to be an incredible presentation tomorrow on every Saturday at 10 a.m. All right, everyone. Thank you for coming, and we will see you again next time.
Next
Thank you
time.
for attending.
Namaste. Namaste.
Thank you so much for coming.
Thank you so much.